Hi, it's Lee Browden here, injury rehab specialist. Now, wouldn't it be great if you could wake up every day, your lower back felt amazing, and you could do whatever you wanted to do without any limitations or restrictions? Well, in today's video, I'm going to be looking at sacroiliac joint dysfunction. So, if I just show you my model Rodney here. Now, what you can see is this is the sacrum right here, and these are ilium on both sides of the pelvis, and the joint in between is the sacroiliac joint. Now, what can happen is that the sacroiliac joint, if it's not stabilized effectively, basically it's bone on bone. I mean, there is a cartilage there, but if there's excessive motion on one of the joints, and the joints are kind of like L-shaped. Now, if there's too much rubbing of bone against bone, that can become quite painful. Now, in most instances, as you might gather from what I just said, it tends to be the side that's more unstable that gets the pain. So what you normally find with the sacroiliac joints, that one of the joints is hypermobile, i.e. it's unstable, it's moving too much, and then generally the one on the opposite side tends to become hypomobile and it's not moving enough. But it's normally, but not always, the side that's hypermobile that tends to become painful. So what can potentially be causing that to be happening? Well, quite often what I tend to see, and I see this in a lot of people with or without sacroiliac joint pain, is that the pelvis becomes twisted or rotated. It's very common. Now, it doesn't mean it's stuck in that position. What it tends to mean is quite often there's a muscle imbalance in the lumbopelvic region that's pulling the pelvis into that rotated position. So I'm going to talk a little bit more in a future video about how you correct that, but also you need to look at, okay, so why is there a muscle imbalance around the lumbopelvic region? And again, from my experience, the most common thing I tend to see is when someone's got sacroiliac joint dysfunction or a rotation or a torsion in the pelvis, they also tend to have what's called an atlas subluxation. So the atlas is the first vertebra in the spine, and when it's out of position, what it does, it puts traction through the spinal cord, and the way that the body compensates to try and take the traction off the spinal cord is that it rotates the pelvis. So you get an anterior rotation on one side, a posterior rotation on the other side. That creates the torsion, that creates the excessive movement within the sacroiliac joint, which eventually can cause pain. So as I said, in a future video, I'm going to talk a little bit more about how we can correct those muscle imbalances. I'll talk more about how we can correct the atlas subluxation. So to make sure you get those videos, please subscribe to the BodyCheck YouTube channel and like the BodyCheck Facebook page. And I look forward to seeing you in a future video. Bye for now.